The Health Ministry is rejecting what it calls egregious and false claims by the People's Power Party, which is seeking to halt COVID-19 vaccinations in the country. In a social media post signed off by its Secretary-General Goh Meng Sing, the party cited studies by what it called prominent medical experts. They claimed that vaccines caused high incidences of severe side effects. The post also tried to link high vaccination rates with excess deaths. Rebutting the claims, the Health Ministry says there is a need to draw the right conclusions and follow scientific evidence on the safety and effectiveness of vaccines. It adds that excess deaths are inevitable in a pandemic like COVID-19, but Singapore was able to keep such numbers low as the majority of the population was vaccinated. The ministry adds that while there are side effects to any vaccinations, scientific evidence overwhelmingly shows that protection from vaccines outweighs the side effects.
If people aged above 80 got COVID-19, there was a 3 in 20 chance that they would die. And that risk drops by age, but it never really disappears. It's very clear on balance. The vaccines have been very important in ensuring that we were able to come out of it and to live life fairly normally as we do today.
People's Power Party Chief Goh Meng Sing is no stranger to making claims against COVID-19 vaccination. In 2021, he was issued a correction direction under Singapore's fake news law for alleging that the HIV and COVID-19 viruses could be combined. He also discouraged the public from taking the COVID-19 vaccine. A year later, Mr. Goh was issued a second correction direction for false claims over the XBB Omicron variant, which he said causes more severe illnesses even among the fully vaccinated. The Health Ministry has also rebutted claims made by what it describes as non-credible sources cited by the People's Power Party. Several claims were made linking vaccinations to increased cases of heart inflammation or myocarditis, particularly among young people. In response, MOH says it does not dispute that the condition is a possible serious adverse event after vaccination. But it says the risk continues to be very rare and is observed mainly among men aged 12 to 29.
Myocarditis is more common after the disease than after the vaccine. So, of course, it's more common. If you compare the vaccine to nothing, then the vaccine, you wouldn't give it. But nothing's not the comparator. It's actually getting COVID and getting myocarditis, which, as I mentioned, is more common with the disease than with the vaccine.
People's Power Party also cited claims that widespread vaccination could potentially lead to the virus evolving and becoming more harmful. MOH notes that viruses naturally mutate as they replicate. It says there's no evidence to suggest that mRNA vaccines contribute to this. It also notes that the Delta variant, which caused a massive wave globally, emerged even before COVID-19 vaccines were introduced.
You're actually vaccinating a large number of people. What you have is really something called inducing the herd immunity in the population, which is able to reduce the size of potential COVID-19 outbreaks from occurring in the population.
The People's Power Party had cited views from 8 doctors from around the world to back up its COVID-19 vaccination claims. They included doctors who were widely reported to be promoting messages against COVID-19 vaccinations. PPP also put up references to 7 articles, almost half of which were co-written by the same author. Dr. Peter McCullough co-wrote 3 of the 7 articles cited by PPP. MOH says he is an American cardiologist who was found to have promoted misinformation about COVID-19 and advocated for early treatment using discredited substances. The American Board of Internal Medicine had reportedly recommended revoking his board certification in October 2022. PPP also cited another doctor's research paper on heart inflammation that has since been withdrawn. Another doctor, that's Dr. Geert Vanden Bosch, is a Belgian virologist. He had written an open letter to the World Health Organization claiming that large-scale vaccinations would lead to monster variants when the virus spreads from the old to the young. PPP did not provide any references for studies done by Dr. Bosch and 4 other doctors that they cite.